Hi, it's Dr. Dan from Fix Me Physical Therapy, and I just wanted to talk briefly today about the reason why insurances don't like to cover neuropathy. And I think the main reason is they just don't want to pay for it. And it's not because there aren't solutions available, it's that the solutions fall outside the normal medical paradigm, meaning drugs aren't going to work, injections aren't going to work, and of course, if it resorts to surgery, then surgeries are just where they're going to start amputating because there's been so much damage that there's nothing that can be done at that point. And when it's gotten that far, the research shows that after the first amputation, on average, somebody has about 2 years left to live. That's just a sign of how much damage has been occurring to the body that's not been addressed effectively. And so that's why our office focuses on the three core causes that lead to this problem. So the neurological damage, the vascular damage, and the metabolic issue. Vascular, of course, is addressed by increasing the sensitivity to nitric oxide, creating more nitric oxide. Neurological is using the Rebuilder 300, allowing the body to calm down, turning that pain off, restoring normal nerve firing function and flow. And of course, metabolic, all of these, by the way, need to be done at the same time to get an effective result. But metabolic being the changes to lifestyle and learning how to eat, what not to eat, so that your body doesn't get that constant smashings from high insulin, because what happens is that insulin resistance is at the core of all of this. Insulin resistance reduces your body's ability to be sensitive to that nitric oxide synthase and nitric oxide. And of course, we need that nitric oxide because the nitric oxide allows the body to, the blood vessels to expand and contract, remain supple, remain young. And of course, as we age, we probably lose a little bit of that sensitivity as well. So that's when our vasculature starts to become stiffer and narrows down. And of course, that leads to the decreased blood flow, which is a bad thing. We don't want that to happen. It's going to happen to a degree as we age, of course, but there's no need for us to hurry that along. So we need to do everything in our power to teach our body how to be sensitive to insulin, respond appropriately, and that's, of course, comes back to feeding the body appropriately. There are special supplements they have with our program that help the body relearn how to respond to that nitric oxide. And of course, just in general, the eating program, we have an excellent online platform that gives you an email a day, shows you exactly what to do, how to do it, when to do it. And so this whole program that we use has been operating, I believe, since 2008, has helped thousands and thousands of people recover with incurable neuropathy. And again, we know it's not incurable. It's just that insurance views it as a progressive chronic disease, so they don't have to pay for it. They'd rather keep you in that system and keep throwing drugs at you and injections and things that don't work. I can't speak to why, I have no idea. It's not important. There is a solution and we have it. So please give us a call if you need our help. 773-852-3335. And there's going to be a link below to an email and also to a blog post about the same thing. But the blog post again talks about the management, because that's what the medical model wants to do. And it's probably stuff that you've already seen, you've already tried, and you already know that it doesn't work. And we do have the solution here. So hope to hear from you soon. Thank you.